Hi, my name is Muhammad Shazwan Obong. I'm a fourth year nursing student from the National University of Malaysia, UKM. This educational video was made for the requirement of the course FFFJ 4124 Gerontology module. So today, I'll talk about the topic of condition and illness of the elderly, focusing on malignancy and palliative care. At the end of this video, I hope you will be able to Number 1. Discuss the prevalence and risk of cancer in older population. State the factors that increase the risk of cancer. Outline preventive measures that can reduce the risk of cancer in older adults. Describe increased risk for older adults receiving conventional cancer treatment. Discuss reasons for patient choice to use complementary and alternative medicine (CAM). Discuss nursing consideration in caring for older patients with cancer, and for the palliative care, you will be able to discuss the principle of palliative care and the practice of palliative care. Caring for older adults with cancer is a nearly inescapable aspect of gerontological nursing. As stated by Centers for Disease Control and Prevention 2013, cancer is a disease of older people, being the second leading cause of death in persons 65 years and older. Most new cases are diagnosed in older adults, and the probability of developing this disease dramatically increases with advancing age. The National Cancer Institute acknowledged that age is the most important single risk factor for cancer. Cancer rates increase from childhood on, with the most dramatic increase in cancer rates. The prevalence of cancer in older adults will rise in the future as the older population continues to grow. Okay, now let's talk about aging and cancer. Older adults with cancer face a greater challenge compared to other age groups. Despite having the highest rate of most cancers, older adults have the lowest rate of receiving early detection tests. Thus, their disease may be in advanced stage when diagnosed. In addition, the presence of multiple health conditions elevates the risk of complication, disability, and the death for older patients diagnosed with cancer. Survival rates for older adults are lower than in younger persons for most types of cancer, even if they are diagnosed at the same age. As mentioned, cancer primarily a disease of old age. But why is that so? There are two major theories that attempt to explain the increased incidence of cancer with age. The first has to do with biological, age-related changes that impair their ability to resist diseases. Prolonged exposure to carcinogens over the years is another explanation for the rising incidence of cancer with age. Although the extent of responsibility that either age-related changes or exposure has in the development in cancer cannot be clearly stated, it is evident that aging adults face an increased risk of developing cancer. Therefore, the reduction of risk factor is beneficial. The risk for cancer offers insights into some of the preventive measures that could prove useful in avoiding these diseases. For the risk factors, women have special risk for breast and ovarian cancer because most breast cancer and ovarian cancer occur in women over the age 50 years. Increased age is a factor. In addition, women who had their first menstrual period before the age of 12 years or experience menopause after age 55 years have a slightly increased risk of breast cancer, as do women who had their first child after age 30 years. Use of and exposure to tobacco products is another risk. Cigarette smoking is the leading cause of lung cancer death in both men and women. Repeated exposure to ultraviolet rays from the sun, sun lamp, and tanning beds can increase the risk of skin cancer, particularly in persons with fair skin. Also, researchers have discovered that people who ate diets high in animal fat had higher rates of stomach and colorectal cancer. Obesity increases the rates of cancer of the prostate, pancreas, uterus, colon, and ovary and breast in older women. Exposure to carcinogens such as the contamination of drinking water from nitrate has been associated with an increased risk of non-Hodgkin lymphoma. Heavy alcohol consumption increases the risk of cancer of the mouth, throat, esophagus, larynx, and liver. Some people think that because stress and other toxic emotions can depress immune function, they also can contribute to cancer. The prevention actions to reduce risk. First, avoid the use of and exposure to tobacco products. Second, limit exposure to the sun. Use sunscreen rated between 15 and 30 SPF, skin protection factor, and avoid sunbathing. Third, eat a diet rich in fiber, fruits, and vegetables, while limiting intake of red meat, fat, fried food, and pickled, smoked, or cured food. Fourth, maintain weight within an ideal range, exercise, and be physically active. Fifth, protect yourself against exposure to known carcinogens. And the last, limit alcohol consumption. In addition to preventive measures, nurses should educate older adults about cancer screening. Early detection can improve prognosis of cancer and should be encouraged for persons of all ages. Some of the recommended tests were annual checkup that examine the oral cavity, thyroid, breast, ovaries, testicle, and skin, annual mammogram and clinical breast exam, annual fecal occult blood test, every 10 years a colonoscopy, if flexible sigmoidoscopy, double contrast barium enema, or CT colonography is positive, a colonoscopy should be done. One of the following every 5 years: flexible sigmoidoscopy, double contrast barium enema, CT colonography, virtual colonoscopy, annual PSA test, and digital rectal exam for men over age 50 who have a life expectancy of at least 10 years. PEP test every 2 to 3 years if there have been 3 consecutive normal tests and no abnormal PEP tests in the last 10 years. A woman 70 years and older may choose to discontinue cervical screening, as suggested by American Cancer Society. Lastly, annual endometrial biopsy for women at high risk for hereditary non-polyposis colon cancer. There are two choices of treatment for people living with cancer, that is conventional treatment and complementary and alternative medicine CAM. In conventional treatment, the plan depends on the specific cancer. Most treatment involves surgery, radiation, chemotherapy, and biologic therapy. Persons over the age of 70 years have higher risk of mortality and complication from all surgeries, and this risk is heightened with emergencies of unplanned surgeries. In CAM, complementary and alternative medicine, special diet, psychotherapy, spiritual practices, vitamin supplement, and herbal remedies are used by many people with cancer. This treatment often attractive to patients because of the healing philosophies and approach used. CAM practitioners offer 1. Relationship-centered care, 2. Support, 3. Healing partnership, 4. Comfort, and 5. Hope, particularly when conventional medicine has exhausted its treatment. CAM practitioners provide options that can offer hope and encouragement through knowing that something is being attempted. Although CAM can contribute to patient care, it is unwise for patients to use this therapy without carefully weighing risks and benefits. Lastly, the nursing consideration for older adults with cancer. Gerontological nurses have a commitment to promoting healthy aging. This includes health promotion and health education. Firstly, providing patient education. This education need not be limited to older adults. Cancer prevention to younger people can promote a healthier senior population in the future. Nurses play an important role in ensuring that patients understand the warning sign of cancer. The American Cancer Society used the word caution, in which each letter represents the first letter of a warning sign. Provide a useful way to remember them. C. Change in bowel or bladder habits. A. Sore that does not heal. U. Unusual bleeding or drainage. T. Thickening or lump in the breast or elsewhere. I. Indigestion or swallowing difficulty. O. Obvious change in a wart or mole. N. Nagging, persistent cough or hoarseness. In addition, nurses assess patient knowledge of self-examination for cancer and provide instruction as needed. Next, promoting optimum care. When the diagnosis of cancer is met, The nurse can help the patient to obtain the best possible care. Older adults receiving radiation and chemotherapy require the same basic care and face the same general risk as adults of any age who undergo this treatment. Close monitoring and taking action to prevent complications, for example reporting changes in vital signs or increased fatigue, are essential. A significant fear associated with cancer is pain. Patients need to be assured that pain can be managed. The nurse should regularly assess for pain and assist in developing a plan to prevent and manage pain. Last but not least, providing support to patients and families. The diagnosis of cancer can be devastating for patients and their families. The cost of treatment could present significant burdens to patients and their families. Plans and pursuits may have to be forfeited as treatment of the disease takes center stage. The nurses should assess the patient understanding, clarify misconception, and offer explanation when needed. Providing ample opportunity for the patient to express feeling is very important. Now that you already understand more about the malignancy in older adults, let's continue to discuss regarding palliative care. The first question is, what is palliative care? The goal of palliative care is to help people feel better. It prevents or treats symptoms and side effects of disease and treatment. Palliative care also treats emotional, social, practical, and spiritual problems that illnesses can bring up. When the person feels better in these areas, they have an improved quality of life. Palliative care can be given at the same time as treatments meant to cure or treat the disease. Palliative care may be given when the illness is diagnosed, throughout treatment, during follow-up, and at the end of life. Now, who receive the palliative care? Palliative care may be offered for people with illnesses such as cancer, heart disease, lung disease, kidney failure, dementia, HIV and AIDS, ALS, and amyotrophic lateral sclerosis. While receiving palliative care, people can remain under the care of their regular provider and still receive treatment for the disease. Any healthcare provider can give palliative care, but some providers specialize in it. Palliative care may be given by a team of doctors, nurses and nurse practitioners, physician assistants, registered dietitian, social workers, psychologists, massage therapies, chaplain or palliative care may be offered by hospital, home care, agency, cancer centers, and long-term care facilities. I'm mostly sure that you know palliative care or hospice care. The difference between these both is that palliative care can begin at diagnosis and at the same time as treatment, while hospice care begins after treatment of the disease is stopped and when it is clear that the person is not going to survive the illness, but both palliative care and hospice care provide comfort. Hospice care is most often offered only when the person is expected to live 6 months or less. Next, what does palliative care include? It includes a serious illness affect more than just the body. It touches all areas of a person's life, as well as life of that person's family members. Palliative care can address this effect of a person's illness. It is involved in managing physical problems, emotional, social, and coping problems. Practical problems and spiritual issues. In physical problems, symptoms or side effects include pain, trouble sleeping, shortness of breath, loss of appetite, and feeling sick to the stomach. The treatment may include medicine such as morphine, nutritional guidance, physical therapy, occupational therapy, and integrative therapy. Meanwhile, in emotional, social, and coping problems, patients and their family may face stress during illness that can lead to fear, anxiety, hopelessness, or depression. Some family members may have to take on caregiving even if they also have jobs and other duties. The possible treatment may include counseling, support groups, family meeting, referrals to mental health providers. In practical problems, some of the problems brought on by illness are practical, such as money or job-related problems, insurance questions, and legal issues. A palliative care team may explain complex medical forms or help families understand treatment choices, provide or refer families to financial counseling, or help patients to seek resources for transportation or housing. I hope you understand regarding malignancy and palliative care. Thank you for watching.